Now there are mainly two types of meniscal tears. One is called as traumatic meniscal tears, which is more common in the young population. And then there is a degenerative meniscal tears, which is more common towards the older population. Usually there is always some degree of trauma in both the cases, but in the case of degenerative tear, there is a soft tissue has degenerated over the period of time. Therefore, even trivial or a minor trauma can lead to this problem. Now, what type of meniscus tears happen? There are broadly two ways of classifying. As you know, that blood supply of the meniscal tear is such that one can be divided into three zones. That is, the outer 1/3 is red zone, in middle 1/3 is red-white zone, and inner 1/3 is white zone. So one way of classifying meniscus tear is depending upon the zone of involvement. We can classify them as red zone tears, red-white zone tears, or white zone tears. Other way of classifying is on the basis of how the fibers are arranged. As you know, the fibers are arranged radially as well as the circumferentially. Therefore, depending upon how the tear has geometrically progressed, this can be divided into a vertical tear, which is involving like this, or it can lead to a bucket handle type tear, in which the inner 1/3 is actually moved out and in forming a kind of a bucket of a handle, in which this tear has actually mainly progressed through the red, white and white zone. Or it could be a simply transverse, in which mainly the tear is in the white zone only. Similarly, there could be a degenerative tear and as well as complex or a parrot beak tears as well. Depending upon, usually the traumatic injury or degenerative tears usually have a complex type of anatomy. There may not be one, or there may be more than one type of geometrical lesion may be present. There may be longitudinal as well as radial tear present in one side, and there may be a longitudinal tear all along the length as well. So there may be these lesions may be called as the complex lesions. Now what is important over here is that once we have classified the injury, we usually this is one way of doing it. What is important to remember is that how the blood supply actually affects the healing.